the middle of Medicare's annual election period, and many people are asking about whether they should get a Medigap insurance plan with their original Medicare, or switch from, if they can, from Medicare Advantage to original Medicare with a Medigap plan. And here to talk with us about that is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
So one of my favorite topics, Medigap plans. What are you seeing now that we're 2 weeks into Medicare's annual election period?
We are seeing notably higher premiums, Bob. That is the bottom line. It can be from a number of different reasons. Of course, the increased cost of health care itself being the primary. The second is that higher usage of healthcare services. So you have this double whammy, if you will. Remember that Medigap carriers have to spend something called a medical loss ratio in order to justify their premium increases. In addition to that, there are some other dynamics going on. We have talked about the birthday or anniversary rule in certain states, a trend which seems to be growing, accelerating, if anything, that this also will contribute invariably to higher Medigap premiums. I think that is inevitable, and anecdotal evidence proves it with maybe only a couple of exceptions. On other matters, like you said, that this is, as a result of this, switching from Medicare Advantage to Medigap can be a complicated choice. Something like 20 million people on Social Security alone rely on Social Security alone. This means that a married couple is looking at something on the order of $3,500 a year of Medigap premium by itself, plus Part D, albeit that there are Part D plans that cost $0 a month. Nevertheless, to a family that relies on Social Security alone, the number is high, and the rate increases that we have seen, 10% at the low end. We've seen 20% and higher than that on a year-over-year basis.
And in some cases, or I guess in all cases, it's the state insurance department that's regulating the insurer in those states and then approving these rate increases. Is that fair to say?
That's exactly right, Bob, which is that the Medigap carriers have to propose their rate increases. They need to supply their data to justify it. And I'm going to tell you as a practitioner that this is not an easy exercise. And the way I can tell is that even after rate increases, that the prices, the difference amongst the carriers is just not very much. Meaning that even for a 67, 68-year-old, 70-year-old, we can find Medigap premiums within $1 to $2 a month after the increases. So as a result, I understand that it's easy to say, well, the rate increases is just some random number that the carriers are inventing. That's not true when it comes down to me examining the prices on behalf of our clients, because those who can switch for lower prices, we will guide them there if we can find them for sure.
Yeah. And my understanding of Medigap premiums is that if you enroll in Medicare at, say, age 65, that the premium for you is roughly the same as it is for someone who's 85, or is there a difference?
Well, someone who's 85 is going to have higher premiums due to attained age, which is the general way that Medigap is priced, meaning that it increases with age. It increases with the usage of the pool, not your individual claims, your individual experience. There can be carriers that change that pricing structure to some degree, meaning that once you meet a particular age, then it can be a flattened out Medigap premium amount. That all said, in the earlier years, those carriers that select that type of structure generally have higher premiums in the earlier years. So this is not predominantly the large majority of carriers, which is year by year, but it can exist in certain cases.
Yeah. So your advice for folks who might be witnessing a premium increase and maybe they're in a plan that has the greatest number of features, would it be to move down to a lower version of a Medigap plan?
That's a very good question, Bob. That generally speaking, I first would suggest to people that they seek the same plan with a different carrier. I said that the pricing is difficult, and I said the pricing is very competitive, but there can be opportunities for, especially when there are two people. Maybe $20 a month isn't enough to warrant a change. But if I told you then that is doubled because you are married and now this is $500 a year, now it gets people's attention. So I would say this is true. So if you can qualify for underwriting, that you can switch carriers and know that it does not depend on the month of the year. You can switch any month. You could switch every month. I'm not recommending someone switch every month by any means. My point being the flexibility exists. You don't have to be changing for January of 2026. You can change in July if that is the best fit for your household, for sure. For as far as your second question, moving down, that's possible. That is possible. For example, the two most popular plans are Plan G and Plan N. I would urge caution to understand that there is a difference in the policies, the language of the policies, that beyond today, that some explanations I've seen have probably understated those differences. That said, there is a notable dollar difference, meaning that if we need to save a lot of money, let's just call it $35 a month between the two G and N, and you have a couple, now it's $70, and now it's 12 months, and now you're at $840 a year. That all said, on the back end, these contracts are not precisely the same. And as long as our clients understand that, then we are happy to guide after this is very clear.
Yeah. Here in Massachusetts, I only have a couple options. I don't have the vast array that many folks in the rest of the country have. Any advice for folks? I think there are a couple other states that have just a few number of plans to choose from.
Well, I think they take full advantage of the other nuances here. So Massachusetts, for example, has a specific window where you can go from Medicare Advantage to one of these limited sets of Medicare supplement plans, which are tailored specifically for Massachusetts. So someone could be diagnosed with a particular health situation that they may think that Medicare supplement may be the superior setup, and to know this and act accordingly. And that is good in the sense that those people are able to take advantage of this flexibility. And also, if they wanted to be very frugal and needed to be, that prior to that, they could have been on Medicare Advantage. They could have, in those particular states, have your cake and eat it too. That is possible.
Yeah. Lucky me, I guess, right?
Lucky you. Patriots only bad for a couple of years and now back on top. Lucky you indeed.
Dynasty Part 2 continues. Jay, we've covered a lot of ground. Anything we missed about Medigap plans? Or
No,
I guess
thankfully you've spared me the fact that I'm a lifelong Dallas Cowboys fan, so that's good. Medigap is far more safer frontier for sure.
Yeah. All right. Jay, as always, it's such a pleasure having you sharing your knowledge and wisdom with us. We're especially grateful for you helping our listeners navigate the complex world of Medicare, Medigap, all things healthcare.
Bob, it's always my privilege.